I will call this meeting to order. The Board of County Commissioners, October 24th, 2022. And I'll begin by reading the public charge. The Board of Commissioners ask its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. Are there any agenda adjustments? Hearing none, I think I just skipped over the Pledge of Allegiance. So why don't we all, if you'll all stand with me, and Commissioner Long, would you lead us?
United States of
America, and to the republic for which it stands, one nation, under God.
Thank you. Okay. Next, we will have our announcements, and we will ask our clerk, Ms. Wallace, if she will read our announcements for us.
Good evening, commissioners and public. I will read the announcements that are in our agenda. Some of the websites I will not read, but they are available online. DECO Public Health COVID-19 Vaccination Clinic Hours. The COVID-19 Vaccination Clinic at the Durham County Department of Public Health, located at 414 East Main Street, have the following walk-in hours for your free vaccination: Monday, Wednesday, Thursday, and Friday from 9 a.m. to 4 p.m., and Tuesdays 9 a.m. to 5:45 p.m. All approved doses are available. Please note clinics are closed between 11:30 a.m. and 1 p.m. daily and on Saturday and Sunday. Please visit decopublichealth.org/COVID vaccines or call 919-560-9217 for more information. Next, Sheriff Speaks session on expungement process. On Wednesday, October 26th, Durham County Sheriff Clarence Burkhead will host a community discussion. The Sheriff Speaks with Durham County about the expungement process. This series of community discussions is open to all residents and it is free of charge. The session will be held at Antioch Baptist Church, located at 1415 Holloway Street, beginning at 5:30 p.m. Kate Feldman from You Can Vote, Sheriff Burkhead, and representatives from Legal Aid NC will be panelists. Margaret Killjoy book tour comes to the main library. Join author Margaret Killjoy on tour as she celebrates the release of her forthcoming collection, We Won't Be Here Tomorrow and Other Stories. She will read selections from her new book, discuss many projects, and answer questions. The event is at the Durham County Main Library on Wednesday, October 26th from 6 to 7:30. Registration is required. You can do that at the Durham County Library website. Residents and businesses are invited to participate in Operation Greenlight from November 7th through the 13th. The Durham County Veteran Services Department and the National Association of Counties invite all Durham County residents and businesses to participate in Operation Greenlight on November 7th through 13th by lighting up your porch, lights and windows, or business lights with green to bring awareness to the unique challenges faced by many veterans and the resources that are available. There is a website, www.naco.org, for additional information. Child tax credit deadline for easy claims is November 15th. The deadline of November 15th is fast approaching, and simplified filing for 2021 expanded child tax credit. The portal, which is www.getctc.org, allows families to easily claim the tax credit. Simplified filing makes it easy for families with no or low incomes to gain the 2021 credit, and potential other dollars. It has been extended until April 2025, and you will need to file your full tax returns to receive it. Websites now live for student loan forgiveness. The U.S. Department of Education is now accepting applications for student loan relief, beginning now through December 31st, 2023. This loan relief can erase up to $20,000 for Pell Grant recipients and up to $10,000 for non-Pell Grant recipients. Please visit studentaid.gov for additional information and to apply. Volunteer for the new Cultural Roadmap Planning Group. Durham County and the City of Durham have entered into a joint agreement to govern the development of the new Durham Cultural Roadmap. This roadmap is an updated strategic vision to guide and support the Bull City's local arts and cultural ecosystem and the artists and creatives that make it vibrant. Led by the Durham Cultural Advisory Board, development of the cultural roadmap will include input from the Cultural Roadmap Planning Group, comprised of volunteers who reflect the diversity of Durham, including youth, members of the cultural and business communities. The planning process kicks off in fall of 2022 and is expected to be completed by December of 2023. For more information, please visit durhamnc.gov. The 2022 bond referendum website. Durham voters will be asked to vote yes or no on a three-part general obligation bond referendum during the upcoming general election period. Bonds for Durham Public Schools, Durham Technical Community College, and Museum of Life and Science of $550.2 million will be seen on the upcoming ballot. Durham County government has created a website providing key information about the 2022 referendum, and it can be found at durhamcounty2022bondreferendum.org. Early voting has begun. The early voting period for the 2022 general election began on Thursday, October 20th, and it continues each day through Saturday, November 5th. Election day for the local, state, and national elections, including the three-part 2022 general obligation bond referendum, is Tuesday, November 8th. To find out all the information you need to vote early, by mail, or on Election Day, please visit decovotes.com. And I do have one additional announcement that was not added to the agenda. DECO Veterans Day program returns to in-person on November 10th. The Durham County Veterans Services Department is excited to announce that its annual Veterans Day recognition and celebration program will return in person for the first time since 2019. The ceremony will feature keynote speaker Dr. Alicia Smith, Medical Center Director of the Durham VA Health System. The ceremony will be held on Thursday, November 10th in meeting rooms B and C on the second floor of the Durham County Human Services Building, located at 414 East Main Street, and it will begin at 11 a.m. The entire community is invited to join in honoring service members and their families from all branches of service during this celebration. And remember that Veterans Day holiday is on November 11th. That concludes the announcements that I have for this.
Thank you, Ms. Wallace. And all of those, as she stated, all of those announcements would be on our website. Other announcements?
Thank you, Chair Howerton. I have two announcements. One that the Durham County Big Sweeps cleanup is still going on. There is two more cleanups. One is tomorrow and one is on the 29th. But if folks are interested in beautifying Durham even more and helping clean up the community and the creeks or different parts, you can also organize your own. If you go to, if you Google Durham Big Sweep, you'll be able to find ways to sign up. And then also the Durham County Matching Grants Program is still open through November 16th. If individuals want to apply for a qualifying project within one of the priority focus areas that we have, they can receive a grant of up to $5,000. They can email Brendan Moore at brmoore@dconc.gov to learn about how to receive support from the county in projects here in the community. Thank you.
Commissioner Barnes?
Yes, thank you. I'm so happy that our clerk did mention, student loan forgiveness, and that date is December 31st, 2023. However, the application, deadline for the public service loan program is actually next Monday on Halloween. So that is October 31st. So for those of us in here who are in public service, which is everybody in here, if you work for state or local government, you know how it works. You make 10 years of consecutive payments and it's forgiven. So the portal for that one closes on next Monday. So, it's great to get the forgiveness, the 10,000, and let's see if we can get, that 10 years of like payments that we can, put together with income-based repayment and give some forgiveness. We actually saw some people get forgiveness this go round. So again, and I'll get the info to the clerk, but that's next Monday. The other one, along the same lines of education, there is a FAFSA fair tomorrow. Nobody in Durham should be sitting here trying to figure out how to pay for their kids to go to college. And on average, in North Carolina, just in North Carolina, we leave $120 million a year on the table in Pell Grants. Durham takes up a significant amount of that. So tomorrow at the Emily K Center from 6 p.m. to 8 p.m., there's going to actually be a FAFSA fair. So if you want to figure out how to fill out this paperwork and figure out how we're going to pay for you, so they don't have to do like my generation. And, I'm applying for loan forgiveness. It might be a good look. And my last one, do I ask now or later on for my excused absence? Because I feel like
Sorry.
the excused absence.
Okay.
Okay.
What
Yes.
date?
November the 14th. And I know that a lot of people, and it's also education focused. As some of you all know, I've been working on raise the age for high school dropouts in North Carolina. And a cohort of us are going with Governor Hunt out of Tennessee to see how we can bring that kind of thinking to North Carolina. So I will be out on the 14th there.
Okay. So I will need a motion.
I move to approve Commissioner Burns's day off.
And
Second.
moved and properly second. Roll call from the clerk to excuse Commissioner Burns for our November 14th meeting.
I'm sorry, Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, and Chair Howerton.
Aye. Passes 4-0. Thank you. All right. So next is our minutes. Commissioners, we have minutes for September 28th, 2022, and October 3rd, our work session. Are there any edits or any additions to those minutes? If not, I will need a motion and a second to approve for approval.
Madam Chair, I move that we approve the minute as written.
It's been moved and properly second. Get a roll call.
Commissioner Long,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, Chair Howerton.
Aye. Minutes are approved unanimously, 4-0. So next, we are moving, Commissioners, to our ceremonial items. And this first item, it's pretty long, so I'm going to start out by, it's 220600. It's a proclamation. Teach, Lead, and Healthy Homes Economic Initiative and Lead Poisoning Prevention Week. The board is requested to proclaim October 25th through the 29th as Teach, Lead, and Health Homes Economic Initiatives and Lead Poisoning Prevention Week. We have Lenore Smith here to receive the proclamation and share details of any planned. And I have asked Commissioner Burns if she will read that, and then we'll ask Ms. Smith. I know she's here. Lenore is here. Yeah. How are you? It's great to see you, to come to the podium. Okay. Ms. Burns, if you will, Commissioner Burns, if you will read the proclamation.
Peach, Lead, and Healthy Homes Economic Development Initiative and Lead Poisoning Prevention Week 2022. Whereas in 1998, Partnership Effort for the Advancement of Children's Health was established with the support of Congressman David Price and the EPA funding to North Carolina Central University to establish a community university partnership, CUP, with the Northeast Central Durham Community Investment Board to explore the lingering effects of lead-based paint in older housing in the NECD community. And whereas in 2007, under the leadership of community members Marion Lambert, Lenora S. Smith, and the late Effie Steele, and NCCU Public Health Education Department Chair Dr. Theodore Parrish, submitted application and received designation as a 501c3 IRS charitable organization to empower grassroots communities to mitigate home hazards, including lead, mold, pesticides, indoor air quality, and home safety. And whereas in 2009, the state of North Carolina enacted the lead-based paint hazard management program for renovation, repair, and painting, requiring that prior to performing renovation, repair, and painting activities for compensation, companies and individuals must become certified by the North Carolina Department of Health and Human Services, Division of Public Health, Health Hazards Control Unit. And whereas in 2014, Peach became an authorized North Carolina and EPA training provider for the Renovate, Repair, and Painting Training Program after serving 4 years as a training provider with the National Center for Healthy Housing. And whereas in 2016, Peach partnered with the Mayor's Poverty Reduction Initiative to create a Durham RRP brochure for contractors and to initiate a Peach-led risk assessment capacity building and healthy homes project to educate families and to promote children and to protect children from lead exposure, asthma triggers, and physical home safety hazards. And whereas in 2017, as a result of lead repairs by a contractor in violation of the RRP lead safe rule and that caused lead-based paint and lead dust contamination to 2 neighboring properties and where regulatory guidelines prevented contractor accountability, Peach began a series of town hall meetings that culminated with the situational assessment, identification of regulatory gaps in lead poisoning prevention and lead hazards in housing in Durham, North Carolina, that offered immediate short-term and long-term recommendations and was presented to the Joint City and County Board of Elected Officials in May 2019 with the support of the Durham Health Director. And whereas in 2019, to further the situational assessment recommendations, Peach encouraged and the City of Durham Community Development Department submitted a National League of Cities Healthy Housing Leaders Forum application and was one of 6 cities selected to receive technical assistance to advance effective, healthy housing policies, programs, and practices that protect residents from the hazards posed by asthma and lead, and along with other community stakeholders, completed the Durham Healthy Housing City Action Roadmap. And whereas in 2020, during the COVID-19 pandemic, Peach contracted with Cure Americas Global to increase COVID-19 awareness and coordinated and participated in activities that tested vulnerable community members, recruited and vaccinated hard-to-reach community members, and where hired staff became community health workers. And whereas with the cooperation of cooperation of agencies within the state of North Carolina, including Children's Environmental Health and the State Laboratory of Public Health and the North Carolina Lead and Healthy Homes Outreach Task Force, Peach will continue to train contractors in lead-safe work practices and to provide academic and community internships and to provide income opportunities for low-wealth community workers, all in an effort to assist with the primary prevention of lead poisoning to the 8,300 high-risk children in Durham County and to help improve healthy homes for all Durham's residents. Now, therefore, it be resolved, I, Brenda Howerton, Chair of the Board of County Commissioners, and on behalf of the Durham Board of County Commissioners, do hereby proclaim October 23rd through the 29th, 2022 as Peach Lead and Healthy Homes Economic Development Initiative and Lead Poisoning Prevention Week in Durham County. This, the 24th day of October, 2022.
Thank you, Commissioner Burns. Ms. Smith, it's great to see you.
It's good to see you too, Chair Howard. And I just want to say how happy I am to be before this historical board and what it even makes this recommendation even more special to Peach. So thank you so much. And I do have some brief prepared notes just on the origin of peach. And I I do want to recognize that there are a few people from Peach, our board, and from the community who are here. And so I do want to recognize them, and I would like to take a minute. I know Durham's a busy place, and this Saturday is one of those busy days, but while you are out and about, if you get the opportunity to come by 800 North Mangum Street, we'll be having our annual lead poisoning prevention event from 11 o'clock to 3 o'clock. And this year, we're having Tamara Rubin, who is known as the Lead Safe Mama, and she tests consumer items with an XRF, or X-ray fluorescence analyzer, to determine whether they have lead or other heavy metals, and we'll also have raffles during that process as well. But I do want to reiterate that Peach began as a community-based research project between the Northeast Central Durham community and North Carolina Central University to explore the lingering effects of lead-based paint in older housing. And Peach has persevered since 2007, when we received our 501c3 designation. Over those 15 years, with the help of an ever-present stream of community volunteers who often became Peach staff, the support of local universities, businesses, and organizations. When I started volunteering with the Northeast Central Durham Partners Against Crime Association, resounding mantras from the community included the need to improve housing, to create income opportunities for low-educated residents, and to improve the quality of education for our children. Through my work with Peach, I learned that lead poisoning during a child's development, it affects their ability to learn. I also learned that government regulates contractors who disturb paint in pre-1978 housing, and that presents an ongoing need for skilled craftsmen to be certified as lead workers. And that children who are most at risk of lead exposure, I also learned that children who are most at risk for lead exposure spend most of their time at home. The Peach mission to improve community health by creating a sustainable workforce to reduce environmental hazards was derived from these concerns. In our model to educate and train low-income contractors of color, we believe it initiates a solution strategy to implement our mission and to draw the organization closer to realizing our vision, that every child will grow up in an environmentally safe home. I'd like to thank you very much for this proclamation for a whole week, and for it stating Peach Lead and Healthy Homes Economic Development Initiatives. I really do appreciate that, along with Lead Poisoning Prevention Week. And again, I'd like to invite you all to stop by on Saturday between 11 to 3 at the UDI building if you're available. And I just would also, if I may, say welcome to the new county manager. We are happy to have you here in Durham. Hope you enjoy it here with us.
Would you ask your team if they'd like to stand? The ones that are here, if they'd like to
sorry.
stand? You have others here that, if they'd like to
yes.
stand?
Lawrence and Selena, please. Thank
Great.
you. And there are others online, so watching us virtually, so they could throw up hearts or something.
Okay. Well, Ms. Smith, I think I worked with you so long ago, was 2008, so I know that this has been your heart, that you've been working in this field for a long, long time, trying to make a difference for our children. And we thank you for doing that, because it's just been, you've been at it and at it and at it. So thank you for your
Thank
hard
you.
work and your continued work.
Thank you so much, Chair Hamilton.
Commissioners, Commissioner Burns.
Mine is very quick. I've met Lenora does anybody remember right when the pandemic shut the whole world down? You know, we were closing all of the auditoriums, all of the stadiums, but there was a group of us who just had to get one more concert in. And so we met in the parking lot at PNC Arena at Nick Cannon's Wild and Out because we were trying to volunteer for moms. And then the governor said, y'all take y'all behinds home, and he shut the stadium down. And so many people went home, but not you,
Nope.
because you understood that a lot of the people that you worked with also had a transferable skill set. And so not only were you still out there doing this great work with lead, your community health workers were on the front line for the entire pandemic. And so I know that we're celebrating you for this, but I wanted to say thank you for that, because I mean, it maybe 2 weeks later you were right out there, and I saw your folks and I saw you. So just thank you for the entire portfolio of things that you do for the community.
Thank you, Commissioner Burns. I appreciate that. Yes, and I remember, and I did not leave. But one of the privileges of doing community work, especially in the environmental range and as grassroots, when the COVID epidemic hit, we were one of the grassroots community-based agencies that had the opportunity to participate in that frontline work. And we were able to get residents certified as community health workers, and they do continue, not all, but we do have a good number of them that continue to work with Peach. So we're very fortunate about that, and we're very proud of that. Thank you so much.
You. Carter.
Quickly, I also wanted to say thank you to Lenora and echo a lot of what Commissioner Burns said. I really appreciated this resolution because I learned so much about your history, the history of Peach. I didn't realize, especially the part about the training of community health workers and the economic development opportunities by way of training those who help with the lead abatement. So I just think it's fantastic, all that you've been involved in, and now the COVID as well. And you mentioned that you're perseverant. You certainly have been very tenacious over the years. And thank you, and I hope you continue to have great luck with your mission.
Thank you, Commissioner Carter. And I appreciate your support over the years as well as Chair Howerton. We've just been blessed to have the support of our elected officials, because this is one of those issues that concerns all families. Doesn't matter, the lead exposure, lead poisoning does not discriminate. Thank you.
My next item is 220647, recognition of Durham County's Kids I Vote sticker contest. Got the stickers on. And winner Annabelle Rainey. The board is requested to recognize Rainey as the inaugural winner of the Durham County Kids I Vote sticker contest, sponsored by the Board of Elections and Kids Voting Durham. 14 designs were submitted by Durham students in grades K-12. After the designs were submitted and reviewed, over 75 Durham students in grades K-12 voted for their favorite design. Following public meetings to select the winning design, and the board unanimously selected Annabelle's design as the new Durham County Kids I Vote sticker. The new design will be provided to all kids that accompany their parents to vote or participate in a simulated election administered by Kids Voting Durham for the 2022 general election. Chair Baxton. And the Board of Election members, Pamela Oxendine, will provide an overview of the contest and present Ms. Sweeney with a custom plaque displaying her winning design. How about that?
Thank you, Commissioner Burns. Good afternoon. We're glad to be here with you and the other commissioners. I am honored to be here this evening to recognize the winner of the inaugural Kids I Voted sticker contest in Durham County. This is a contest that was executed in conjunction with the Kids Voting Durham. And at this time, I want to turn it over to our facilitator of that event at the Board of Elections, Ms. Pamela Oxendine, to provide additional details.
Thank you. Thank you, Chair Baxton, and good evening to all the county commissioners and Madam Chair. Thank you. We are just so happy to recognize that this is the first contest we did for the children. We're very excited about the Kids I Voted sticker contest. Like Chair Howerton mentioned some details about it, we put this out for Durham County students in grades K through 12, the opportunity to design a sticker. And so we got a tremendous response, which we were expecting. In total, we received 14 designs from students in grades K to 12. Following the close of the design submission, we opened it up to public voting, and we had over 75 students participate in choosing their favorite design. We had the top 3 designs, and they were all very good. And it was placed before the Board of Elections, and we came up all together with one that stood out the most. And after discussion, the board voted on this, and it was designed that was submitted by Annabelle Swansea. And we're very excited to present her today. I'm going to turn it back over to Chair Baxton.
Thank you, Ms. Swansea. If you will come forward, we would love to give you the opportunity to make some comments. And at the end of your comments, we would love to take a photograph with you and the Board of Commissioners.
Thank you so much. I'm really honored to have been able to participate in this, and I'm also honored to have won it. I really wanted to create a design that I think represented the iconic symbols of Durham, so that the citizens of Durham could take pride in participating in local democracy. Thank you.
So, and do you have anything that you'd like to say? So, commissioners, we're going to take a picture in front here with Board of Elections.
Chair Howerton, over here.
Yes.
I thought they were going to mention it. I know a lot of people, when they get their I voted stickers, they get their sticker and they try to preserve it. And you really can't, because you get free stuff. If you go to Main Library, they are turning the stickers into permanent buttons. Yes, that was announced this week, so I don't know if anybody has seen it. But yeah, I sit on library. They are turning, so when you get your I voted sticker, if you go to main library, you're at main library, or you want to take the one you had, they are turning them into permanent buttons. So young lady, that is also a first, I think. So people will get to keep your sticker from now until forever. So that's at main library doing early voting.
So before the Board of Election get out of here, we just want to say thank you. Thank you for the tremendous work that you do so that we have the greatest election in the state. Can I say country? You can say Can I say country? Yeah. That we yeah. Yeah. Thank you. All right. So I think we are down to our consent agenda. So we have a really small consent agenda tonight. Commissioners, we only have 4 items. Were there any items to be pulled by commissioners? Hearing none. These are items that we have discussed during work session, and staff has gone over with us. If there are any other questions or that to be pulled, do that at this time. If not, I will ask for a motion for approval.
Oxendine, going to Washington.
I'm sorry, I can't hear you.
I'm sorry. Move approval, and I just said, way to go, Mary Oxendine, for attending the.
Yeah, is Mary here?
I was wanting to say
So
something.
why don't we go ahead and approve this agenda? And then, Mary, I'd love for you to come to the podium, just talk a little bit about your trip to DC. Is that okay with you? Just share a little bit about it. You'd rather do it on the 7th? Okay. She said she'd rather do it on the 7th. Okay.
Cheering for her.
Yeah. So if
Second.
I can get a motion, commissioners, to approve
I second Commissioner
consent
Carter.
agenda. Okay.
Second.
Been moved and properly second. Moved by Commissioner Burns, second by Commissioner Long.
No, moved by Commissioner.
Commissioner Carter. Mr. Carter. And I need, clerk, if you'll call the roll.
Commissioner Alam,
Aye.
Commissioner Burns,
Aye.
Commissioner Carter, and Chair Howerton.
Aye. Consent agenda approved unanimously. So our next item is other business 220615, Durham County Family Friendly Workplace Policies. The board is requested to hear presentation from Moms Rising presentation. Tina Sherman on the proposal her agency is bringing to Durham County government to adopt pregnancy accommodations and safe days and extend the current parental leave policy of 12 weeks to also include family leave. And our county manager, Burrell, and is here to introduce the resource persons for this item.
Thank you so much, Madam Chair, and we are pleased to have with us this evening, of course, our Director of Human Resources, Kathy Everett Perry, but also along with her, our members of Moms Rising. And I will allow you to introduce yourself, but we have had conversations with this group, and we were just ecstatic about what they proposed to us, and we have been working to expand our paid leave options, but what they have proposed to expand for parental leave was just outstanding, and is something that we wholly and fully adopt. And so we thought it would be prudent for them to come and present this to our board to hear and ask for your approval of these recommendations. So with that, I will turn it over to you all. Thank you.
pull the mic to you.
All right, that better?
That's better.
Thank you so much. First of all, my apologies. I was supposed to present with you before you a couple of weeks ago and was diagnosed with COVID that morning. So thank you for your grace and rescheduling. And my name is Tina Sherman. I'm Senior Campaign Director at Moms Rising for Maternal Justice. So excited to be here. Policies, workplace policies. So I'm pleased to share. Oh, may have. Let me tell you a little bit about Moms Rising. So we are a national organization working on family-friendly policies across the country. And here in North Carolina, we have over 47,000 members, many of them located right here in Durham. So incredibly excited to be a part of the movement to ensure families across the state and across the nation have economic. Durham County was one of the leaders in providing expanding and providing family workplace policies, and we were incredibly excited about that. In 2016, we were the second county, the second community local government in the state to adopt paid leave. And to this date, you are still at 12 weeks of offering paid parental leave. You're still the gold standard for offering that. So thank you for kicking off what has been quite a movement across the state. What we want to talk to you about today is expanding parental leave to paid family and medical leave and to fall under some of the policies that are otherwise covered unpaid under FMLA. So to provide equity, to expand FMLA to cover a variety of caregiving reasons beyond parental. We also want to talk about using existing paid sick days as safe days, as well as provide pregnant workers with modest and reasonable accommodation. So again, in 2016, you were the second county to enact. We have had huge strides across the state. We currently have 23 communities across the state offering paid leave. But we really feel like, again, as a matter of equity and looking at some concerns, some questions, some feedback we've gotten from other communities from their workforces, really the need to expand beyond paid parental leave. Mecklenburg County currently provides 6 weeks of paid family leave to cover a variety of qualifying events, including birth, but also a serious health condition as well. Buncombe and the city of Asheville also provide 8 weeks of paid parental leave and 6 weeks to care for a family member with a serious health. When we talk about using sick days, Durham County has a generous sick day policy. We would love to discuss being explicit with allowing employees to take the time off to deal with issues concerning domestic violence and sexual assault, often arising unexpectedly, but needing that those individuals encountering these issues, needing that time, that paid time off to be able to take care of issues that are coming up around that. We know that nationally, 1/4 to 1/2 of domestic violence survivors report losing a job in part due to violence. Again, they're unable to take that protected time off to be able to handle the affairs, to be able to make the decisions that they need during this. We're really pleased that Governor Cooper signed an executive order back in 2019 for employees under his purview to allow state employees under his purview to use their sick time. And here's just a list of organizations across the state, from the Child Fidelity Task Force to Prevent Child Abuse to the Think Babies Alliance that support using safe days. And when it comes to pregnancy accommodations, We're talking about reasonable accommodations, being able to have a bottle of water, being able to sit at school, maybe an extra bathroom break. But these are simple yet essential accommodations that will allow for, that are very easy to enact, that will allow for healthy pregnancy. Most pregnant workers will not need accommodations, and only minor ones to stay healthy. This is a policy that's supported by ACOG. Is important in, again, maintaining health. We know that 1 in 5 pregnant workers are employed in low-wage jobs, and particularly physically demanding, and that we know that these jobs that are physically demanding increase exposures to toxins and physical hazards. And again, physically demanding jobs requiring prolonged standing, long work hours, or regular schedules. All reasons for considering allowing these minor accommodations under. We know that between allowing pregnancy accommodations can help to prevent miscarriage, low birth weight, decrease preterm birth, and birth. And here are just a few other additional things that additional points that are providing pregnancy accommodation. We also know that in increasing pregnancy accommodations as well as lactation accommodations, that these are all issues that can address our infant mortality crisis here in the state. We are 38th in the worst in the nation for infant mortality, with 6.8 deaths per 1,000 births. Kind of be aware of time. I want to give you all an opportunity to. The pregnant worker accommodations is supported by the North Carolina Perinatal Strategic Plan, the North Carolina Early Childhood Education Plans, and the North Carolina Families Care Coalition. We know that there's little employer impact when it comes to providing these accommodations. It can increase employee retention and morale, help sustain women's labor force participation, eliminates uncertainty that comes with this, this really critical time in a family's life, and also in most states, the response the Chamber of Commerce has received has been supportive to neutral. When we talk about support for lactation benefits, we know that workplace policies that support the ability of a worker to provide breast milk for their child will increase the duration for which women will be then able to continue to breast. So expanding Durham County's current policy from paid parental leave to paid family medical leave would cover the range of FMLA qualifying events, not just parental leave. We'd love to explore using, again, existing paid sick days and paid safe days to cover necessary absences from work due to domestic violence and sexual assault and stalking. We'd love to talk about providing Durham County pregnant workers with modest job accommodations to stay healthy, working so long so those accommodations do not impose an undue hardship on the county. Continued support for lactation. That's my very brief presentation, but I'm here to answer any questions that you have. My colleague Beth Messersmith unfortunately was unable to join us, but we are both here to be able to be a resource.
So much, Ms. Chairman. I am so excited about this, that we were able to get this on the agenda. And would you like to, your partner there, you want to introduce yourself?
I'm actually here for the county with Kathy. I'm Deidre Gonzalez, the benefits
Okay, so you're
She's with me.
with the county, okay. Well, we'll still partners, okay.
Yes.
Kathy, do you have anything that?
I would just say, just as Dr. Swell has indicated, this is not new for us. Dr. Swell had already introduced to you all earlier during the budget season some changes or additions she wanted to make to some of the policies, and it included the family leave by giving 5 weeks of family leave in addition to our paid parental. She also talked about wellness days or safe days, however we want to call that. And we already have the lactation. So the only thing that we haven't fully discussed would be the pregnancy accommodations, but we tend to accommodate those things, those modest accommodations at any time it's presented to us, but we can codify it into a policy if that helps.
Is this, when I received the information from Beth and read through it, I couldn't wait to get it to Kathy and the manager so that they could preview it and to see where it fit within our policies. And just really, really happy to see that it did fit. So thank you so much for bringing it to us. Commissioners, we'll start with Commissioner Long.
Thank you so much. And I think, this presentation is very relevant for me. Also, as a new mom, I will say Commissioner or Chair Howerton actually was very, very excited to tell me about this program as well, because I brought my pump to a meeting and I asked for a break to go pump and come back. And she goes, "We're going to have a room for you soon to do that in." So we're very excited to learn about that. Just thank you so much for the work you're doing here for Durham County, but all the other local governments. I think this is really vital. We have so many employees here in Durham County to make sure that we're accommodating and making sure that we are the best employer here in the county as well. So thank you, Kathy, and your team, and everyone from organizing to get this done.
And we do have a lactation room already right outside of the Wellness Center on first floor. We'll get more, but we have one already.
Congratulations.
Yes, I have admired Moms Rising for a long time and really appreciate this presentation. I think it's excellent. And I also was just delighted to have our staff, bring these additional ways that we can expand our current family-friendly policies, even to make them even broader, and to help more people. I mean, I just feel like all of the things you've suggested are good for children. They're good for working mothers, women, all caregivers, and in turn, good for our organization. We, I think, are always looking for ways to strengthen the workforce and recruit and retain the best workers, and policies like this can really make a difference, I believe. And I also, in addition to Moms Rising, see some Breastfeed Durham nonprofit leaders in the audience, and I wanted to thank you guys as well. And I'm glad to see us continuing to try to do what we can to support breastfeeding in the workplace and in the community. So I would support whatever, I would love to see our staff bring forward some specific policy changes, and I look forward to that, and look forward to I'm imagining we'll be supportive of those as best that we can. So really, thank you for your work and for being here with us tonight and for all that you're doing.
Commissioner Burns?
Mine is really quick. I'm happy to see that you're feeling better. So that's always good. I did have a quick question. It might have been in the presentation, might not, because I know you referenced Governor Cooper's from 2019, and I know that his covers medical appointments. If you have to make a psychological or a psychiatric appointment, which again is all needed. But they would still be able. Oh, clarifying question, and maybe we might have to codify this because I want people to know what their rights are and feel safe. If you're hurt, if it's an accident, you go to the doctor, you got sick leave. I know that for his version, vacation leave was what you needed to use for court date, moving. So do we have that language kind of sort of in there, like this is for this, this is for this, this is for this? I only ask because I just know. I can think, and my colleagues know this. There are just so many women, who are public servants, who are teachers in this community, who have to deal with domestic violence. And taking a day off is the difference between, whether I'm not going to eat today, if I can pick the kids up, if I can take care of the dog, if we're going to go to practice. And so I guess what is the breakdown like? What can you use it for? and then what are some of the other pockets where they can put it in? Because I wanted to know if you've been beaten, you can use a sick day if you don't have the safe day. So could somebody just throw some of that out for me?
So thank you for that question. The good news is that there's lots of flexibility in how we want to design it. So I'll be working with Kathy to develop that language. It's really important to be explicit in allowing safe days so that folks do know that this is the purpose of it and that it's not hidden and behind closed doors, that indeed if you are encountering domestic violence that you do have that right. How we can codify that and what that looks like. Again, Governor Cooper said one thing, but there's different ways that we can do that. Obviously, having some flexibility is really important so that, sometimes those instances need to happen urgently and unexpectedly, and
Right.
you want to be conscientious of privacy and confidentiality. So
Right.
you want to be able to codify what that looks like. But we have many different examples of ways to ensure that that we're being explicit and also ensuring that employees are aware of their rights, and you all as an employer are aware of what the needs are as well, so that everyone is sort of aware. There's many different ways to go about doing that. Some folks have said, when you have time, bring in, a court document, something like that. And some folks have opted to not do that. So
Right.
there's different ways, and we'll work with you to come up with the best language that's what you all decide.
Right. The reason why I thought that, I don't know if you all remember, you probably do, maybe a decade ago, when you think about a domestic abuser, when you think about some of these partners that use power, we've seen people threaten dogs. So now in North Carolina, if you threaten to kill a woman's dog, like we've now said, okay, that's good. And my dog, I had it for 17 years. People say, oh, I can't believe you would be that worried about a dog. I'm like, if the dog is all you have and your partner is threatening the dog, yeah, you're worried. So I think there are all these nuances that people don't think about. So I do just want to make sure that as we're doing this, we might not want our boss to know. I want this. I know you all are working super hard on it, but all of those little idiosyncrasies that are just so very private, we want to make sure folks feel good. And I do want to thank the staff for bringing it forth. And I also want to congratulate my board. There are 100 county commission boards in North Carolina. I can tell you right now, there are some boards that would not have heard this at all because they don't see it as a problem. So shout out to the board, shout out to staff for bringing it to us, and just thank you for all that you do.
So,
I'm sorry, I have one more question.
Sure.
Okay. So I know that there are tremendous social costs to not implementing these sorts of policies. Will you also, when you come back with some language, bring us information on any financial costs that might be associated with them? True financial costs. I'm sure we will think that it was well worth it, but just be good to know.
Absolutely.
In the documents, I read that there wasn't any substantial cost to the county to
Correct.
do these programs. And I really appreciated the information that you highlighted. We already had family, but we didn't have family members. And then we had spouse, but you added domestic partners. And then parents of a spouse or domestic partner. So you added some language that just gives it more, a little bit more meat to it. So thank you for doing that. We are so committed, this whole entire board, on families and our young people to continue to look for ways of things that we can do to help families and to make sure that our children are thriving. And that has to do with healthy children mean healthy parents and healthy moms. You can't have a healthy baby if you don't have a healthy mom. And just being at the conference last week in DC, there was a lot of conversation. And there were 5 women in the room that were pregnant. 5 pregnant females in the room. And I thought, Okay, I didn't bring any of the county people with me, any of the child care folks to DC for the conference. Um, Greensboro had 7. That won't happen again the next time I go. We're gonna care, and if I have to find pregnant females, we're gonna take pregnant women with us. 'Cause I think there were probably, as far as the males in the room, there weren't many. There were probably maybe 5 or 6 out of 60 people. So maybe we could find some dads and take them with us, because this was really about, it was government, it was Congress folks, legislators, commissioners, city, council, having a conversation about how do we begin to look more seriously at funding from a federal perspective for childcare, and make sure that our moms were taken care of. So this conversation is really lifting it up right now, given that we have an election coming up. And how do they educate the new folks that are coming in that this is a really important issue all across the country? So we thank you for this. Commissioners, are there any other questions or comments? Anything else from?
I actually do. I just feel very excited about this topic. I think because it aligns so readily with other policy issues we've lifted up. Just, maternal and child health, investing in maternal and child health, in particular, eliminating disparities for those who are disproportionately impacted. And, you had some lovely slides that showed that direct link.
Yeah.
And how this will help with that. So this is a strategy, right? This, adopting these policies is a great example of a policy solution, one of many that it will take to address the issues around maternal and child health. So anyway, just wanted to say that too. Fantastic.
Shalom.
Chair Howerton's going to regret asking us if we had any more comments. But yeah, I wanted to also just add another comment in relation to what Commissioner Carter mentioned of so many different initiatives that we're supportive of. I want to add on to that also around mental health well-being, because I think, that is so important when we're talking about parents who are trying to breastfeed and pump, the amount of emotional stress and burden that carries. And so lifting that out of them, like constantly having to worry, like, am I going to have time? How that impacts your supply when you don't have the opportunity to pump. How that impacts your child and your well-being. So just wanted to add that on, that this also is an investment in our employees' mental health well-being.
And I will say that Dr. Sewell raised that with the safe days, because as Tina indicated, sometimes people are very private about those things when they have to get a 50B or domestic violence order. So couching those issues together, it doesn't really pinpoint anybody's issues for the world to see necessarily. So she did mention either calling it wellness days or something to take away the stigma that would be otherwise attached.
If there are no other questions, commissioners, comments, I will ask for a motion. Approval?
So moved, Madam Chair.
Second.
Okay, I've got a motion. I need a second.
Second.
Moved and properly
What are we
second.
approving exactly? Do we know?
We would just like to have permission to move forward with making the changes, and then we'll bring back to you all what those changes are and any costs associated with it.
Fantastic.
Still have a motion for.
I'll go again. I'd like to make a motion that we move forward with these recommendations.
Second.
Moved and properly second, move forward with the recommendation. Okay, and clerk, call the roll.
Commissioner Alam. Aye. Commissioner Burns.
Aye.
Commissioner Carter.
Aye.
And Chair Howard.
Aye. Approved unanimously. Thank you so much.
Thank
you. All right. Now we have an update on 220640 Durham County Public Health Focus Update. Rajnik is here. Oh, there he is. Give us an update
Good evening, Madam Chair,
Evening.
fellow board members, Manager Sowell, General Managers, Attorney Darby. It is a privilege to be in front of you today to give you a quick, very brief COVID, monkeypox, and flu update.
Okay.
Right. And I do stress brief. Our cases have declined dramatically. We are certainly in a good place as it relates to COVID. I believe a little under a month ago, I presented to you all, and current case totals were approaching 400. Within the past 7 days, they've dropped dramatically to 237. We did have an additional death today due to COVID, which brings our total to 370 since the pandemic began. Our hearts, minds, and meditations continue to be with those families who've lost loved ones to COVID-19. Again, the latest 7-day moving average is 32, which is a market decrease of 61.14% since this time last month. There are a total of 95,325 COVID cases since the beginning of March 2020 through October 23rd, 2022. Continue to keep a close eye on race and ethnicity trends, and I'm proud to report to this board that we continue to be in a good place. Hispanics are underrepresented. Blacks are proportionally represented at 37.72% of all cases, and whites, population of Durham continues to be underrepresented at 44.04% of our cases. Our positive percent of labs continues to drop. Over the past 3 weeks, we've gone from 8.6 for the past 2 weeks to 6.9% last week. That is indicative of our current state of COVID. Per the CDC, we remain in the green zone or the green level, which is the low transmission. And we are certainly happy about that. We know that we kind of teeter-totter between medium and low. It's been quite a while since we've been high. And the next screen is really paints a vivid picture. Out of 100 counties, 90 are in the low transmission or green zone, with about 9 counties being in the medium or yellow and 1 county being in the red. That is also the case throughout the Southeast. So again, as indicated, we are in a definitely good place as far as COVID-19 is concerned. To the listening audience, COVID testing is still available at the Lakewood Shopping Center, Tuesday through Saturday from 10 a.m. to 6 p.m. But of course, nothing has changed as far as the other locations where you can go get tested. In Durham, we still have more than 30 locations in which you can get your COVID-19 test. But more importantly, at 414 East Main Street, we still have free COVID-19 at-home tests, in which we still have an abundance of, and they're available Monday, Wednesdays, and Fridays from 9 to 1, Tuesdays and Thursdays from 12 p.m. to 4 p.m. Open to all ages. For people who are 18 plus, no insurance, no ID, and no appointments required. Window is still available at the corner of East Main and Dillard Street. In terms of our vaccine updates, again, our vaccination clinic continues to be open Monday, Wednesday, and Friday from 9 to 4. Extended hours on Tuesday from 9 to 5:30. We are offering the bivalent COVID booster and no appointment needed. And we certainly have all brands available for those who are 6 months and older for their initial 2 doses. I'm also delighted to announce that Durham County Department of Public Health will begin to provide boosters to children ages 5 to 11 years old beginning on tomorrow, October 25th, 2022. That is certainly a delight to many parents' ears, and we certainly hope that we get bum rush with a lot of people. Vaccine recommendations, again, we continue to admonish and encourage our listening audience to get your boosters. COVID vaccines are available for everyone aged 6 months and up, and boosters are available for those who are 12 and older. We are in the fall season, and winter virus season is fast approaching. So we recommend everyone over the age of 12 get your boosters. We do have the bivalent mRNA booster, and assuming that it's been 2 months since your last COVID shot. And there's not too many places you cannot go to get your COVID vaccines, but we certainly recommend the Durham Department of Public Health, your primary care physician, and most pharmacies. A quick update on monkeypox. As of October 21st, 2022, Durham has 41 cases. It has slowed down tremendously. Last week, we only had one confirmed case. 100% continue to be male. However, the percentage that are Black or African American is beginning to dissipate. It's at 70.73, still a huge percentage. I will not bore this board with all this jargon. I apologize for this very busy slide. The most important thing I would say is Durham County has reserves of the Jynneos vaccine for monkeypox that is approved for monkeypox, pre-exposure prophylaxis and post-exposure prophylaxis. The other most important part of this slide is the number to call to schedule, which is 919-560-9217. That number also can provide any and all information that our listening audience might have as it relates to monkeypox. Last but not least, moving to flu. Of course, the recommendation is that everyone 6 months and older get their flu and your flu vaccine, with the rare exception of people who have severe life-threatening allergies to any ingredients in the flu vaccine. For our listening audience, 65 and older, we do have the high dose available in all availabilities. September and October are generally good times to get your vaccine, your flu vaccine. So, of course, as mentioned previously, you can get your flu and your COVID-19 shot at the same time. You can also get it at the Department of Public Health here in Durham. But again, if you're not able to make it to the health department, your primary care physician or most pharmacies are able to do it. And I would be remiss if I did not mention, in the news, you all have seen that there is a heavy influx of non-COVID, and I stress non-COVID, pediatric hospitalizations. Hospitals nationwide are really getting overrun, and I strongly encourage the listening audience to really consider getting your children vaccinated for the flu. Again, it's quite peculiar that it's a non-COVID overrun in the hospitals, but again, that's indicative of the fact that we are coming out of COVID, and again, masking has its advantages. And happy to report that again, we still see a lot of people masking, particularly their children, when they're going in crowded spaces, but this is concerning, and we certainly would hope that our listening audience and our residents of Durham would do the right. That concludes my presentation. I hope it was brief. Hope to be able to answer your question.
To say that one more time, that you can get your flu and your COVID vaccine at the same time at the health department.
At the Department of Public Health.
Say it
Or your
again.
primary care physician, or at a local pharmacy.
Questions? Concerns? I don't see any hands. It looked like you did a great job, as you always do. Commissioner Carter.
I'd leave without asking him any. Rod, thank you. Very, very good presentation. It's great to see our numbers down to 32 is a 7-day moving average. I look at the New York Times every single day to see what we are, what Charlotte is, what North Carolina is, and what the nation is. I think they're behind. Our data is behind. Their data is behind us. I think our data is more real time. But anyway, it is so good to see that. I do hope that people continue to mask and do things like you suggested. I just worry about the cold weather, and we would hate to see a spike, and I know there's concern that could happen. And one way, I guess, to know is to be very vigilant with surveillance. I always ask you about the wastewater, and you said we were able to do a little bit more of that at two sites, I believe. Are we looking at that so that we would get an early warning sign, if if numbers were starting to increase since wastewater, I guess, provides the information the soonest.
We are, Commissioner Carter. Thank you, as always, for your excellent questions. We are continuing to monitor that. As mentioned several weeks ago, we were successful in rallying the state to get us that third site. So we have a nice comprehensive picture of our wastewater surveillance. I will say that our wastewater surveillance numbers are down. Proud to say that they were able to test for a number of things in wastewater, to include monkeypox, RSV, and COVID, and a number of other variants. But we receive that report every week on Tuesday. I share it with my data team and our population health division, and we use that to make some decisive decisions. But it's just down all across the board, and I don't want to jinx it. I don't want to talk about it too much, but I just want it to stay there.
Great news, and I just think it's so admirable that we're, being prepared in advance, even by monitoring the wastewater. You don't know what you don't look for.
That is correct.
It's really good. Thanks, Rod.
Other questions? Thank you very much. We appreciate it. As Commissioner Carter said, we really appreciate hearing that the numbers are trending down. That's good for Durham.
Public Health continues to thank you for your support.
Thank you. Thank you, sir. We are down, commissioners, to our board and commissioner appointments. Attorney, are you ready?
Yes, I'm ready. How's everyone this evening? You have selected 9 people to serve on 7 different boards or commissions, and the results are as follows. Justin Hall, Board of Adjustment. Alexa Hamel to the Citizens Advisory Committee. To the Discovery Durham Truism Development Authority. Jennings Brody and Daniel Edwards. To the Durham County Women's Commission, Rita Denning and Catherine Wui. To the Durham Open Space and Trails Commission, Fred Mayotte. To the Durham Workforce Development Board, Angelica Thacker. And to the Industrial Facilities and Pollution Authority, Fred Mayotte. Those are your results.
Thank you, Attorney. And congratulations to all the citizens that were selected. We appreciate your service. We have so many boards, and you do so much work in making sure that those boards are covered. We thank you for participating, and anyone else that's listening tonight and see a board that they would like to serve on, please don't hesitate to apply. Thank you. Commissioners, we have a closed session. At this point, the board is requested to adjourn into closed session to consult with an attorney employed or retained by the public body in order to preserve the attorney-client privilege between the attorney and the public body, which privilege is hereby acknowledged pursuant to GS 143-318.11A3. I need a motion to go into closed session.
I move that we go into closed session for the reasons stated.
Second.
Moved by Commissioner Lum, second by Commissioner Burns. Roll call.
Commissioner Alam, Commissioner Burns,
Aye.
Commissioner Carter, and Chair Howerton.
Approved unanimously. We are in closed session. In closed session, given direction of staff, no action needs to be taken, and I will ask for a motion to adjourn.
So moved.
Second.
It's been moved and properly seconded. If we could have a roll call, please.
Commissioner Alam.
Aye.
Commissioner Burns.
Aye.
Commissioner Carter. And Chair Howerton.
Aye, we are adjourned. Thank you.